Start with the trauma, but start with whatever it is they're presenting with. I'm anxious, my thoughts are running all the time. Okay, let's have a look at that. See if we can do something with your thoughts running on all the time. Okay, so go to where how they're coming to meet you. Go with what they're presenting. And if they're going, well, it really wasn't all that big a deal. They could be embarrassed, they could be ashamed, whatever. And just say, well, what brings you here today then? And then they'll tell you, I'm having headaches, whatever. And they may claim that they're not related, and maybe they're not, but start with what's in the room.
Thanks.
The other piece that I would add to that is, for those people that have done much EFT, what you know is, or probably have experienced, is that the tapping experience helps one to focus on more than just a conscious level. In other words, the tapping actually allows for the release of thoughts, memories, and connections. And so during a tapping session, the actual tapping process, even though I'm not feeling that much about that experience, and when we start to begin to tap, whether Suzanne's approaching you talking about the primary symptom, that often what will happen is associated thoughts and realizations will start to come to the surface that they weren't over here when they first started talking. So getting back to the tapping technique is an effective way of bringing forth that which is underneath the layer of, no, it's fine.
But on the other hand, you should not have an agenda as a practitioner. Yes. I'm going to unpack this story. I'm going to get at this trauma.
Right. Other questions or thoughts or comments? Whether it's working with a client, whether it's about EFT in general, whether it's about research, anything? Yes?
I think Dr. Church, isn't he making some headway working with the DOD or the VA or somebody? And are we making any headway in getting the military or government?
Yeah, right here in this room we are.
Okay.
And so that's what I'm going to say. It's individual elements and cells of pockets of progress that are happening, one person at a time, one practitioner at a time. And then there's always administration changes and bureaucracy changes. So the research we're doing is making a difference. Okay. What we're doing here and what's happened at Joint Base McCord is amazing. And all of those things are happening in different places. And so it's a growing energy that's happening. But I wouldn't say, oh yeah, we're about to crack this one and it's about to be in the VA. It happens one incremental step at a time. And this is a great example of what's happening.
Yeah, we addressed that.
I'm going to repeat back what you say for those that can't hear, if that's all right.
We're not making visible, formal progress with the VA.
Right, so we're not making visible, absolute things that are visible with the VA yet.
But we are making real progress with people who work within the VA, who are doing hands-on work with the vets, and who are bringing it, weirdly enough, from the grassroots up within the VA system.
Great. So what she's really saying is that it's individuals like people that are here that work in the VA systems, one person at a time, that's learning EFT, that's expanding, that we're seeing as students that are then spreading the word and teaching their interns, and they're kind of on the fringes that are bringing it forward, and it's bubbling up, but we don't have an official declaration yet of this is accepted or not accepted, etc. Yes, in the back. And again, I'm going to repeat back for the camera if it's okay, so if you can keep it to like 2 sentences at a time.
Okay. I just want to say that I have been working in the VA as a temporary locum tenens psychologist. This is more in the southern United States than in this part of the world. I was told to my face, not by the director of the mental health program in a Veterans Administration hospital, don't mess with our program.
Okay, so just to stop for a second, so this is a psychologist working in a VA system who was told don't mess with the program very directly.
And I volunteered my services free of charge to available veterans within the program, and they denied access.
Right, so he's hitting a wall by having his offering of free services denied and not allowed.
And I had a chance to talk with many of the veterans who were attending the weekly group therapy meetings who completely denied the party line, if you will, of the Veterans Administration mental health director. They said they did nothing more than come in once or twice per week, tell their stories, and leave. And that's all the intervention consisted
Okay.
of.
So the frustration of which we've heard over and over is people that come to the VA with traumatic elements, if they have the courage to do that, and basically they retell the story or they rewire.
May I say one more thing?
Of course.
My doctoral dissertation was on the area of stress and its relationship to illness. That was the title.
Stress and its relationship to illness. This is
Yes,
PhD
physical
thesis.
illness.
Okay.
I have read much of what Dawson Church has written. and I've talked to him directly. I have read books that he has co-authored with other people more recently. And nobody talks about what is known about what is the manifestation of stress and what is some of the research that supports its presence. And it has lots to do with the amount of change in a person's life that subsequently leads to illness. If there's too much change in too short a period of time and not enough time to recoup, then we see the onset of many kinds of illnesses and other accidents and other problems that develop. There are even scales that have been published that measure this.
Sure. So he's speaking about work, for example, that's referenced in Dr. Scare's The Body Bears the Burden and many others, that he's referring to how much stress people go through with a lot of change that isn't given the space to re-equilibrate and regulate afterwards, and how stress has an effect on health and well-being in the body.
It seems to address the body's compensatory responses as identified as early as the mid-1960s by Hans Selye, and continues today. Nobody talks about it.
Well, I think that there are. It's not spoken of enough that nobody speaks about it. However, it's very relevant to what we're talking about, and I am just going to allow, because we are short on time, if there's a question or a final comment you'd like to...
The last comment that I want to make is that there's a big difference between a patient's behavior and their feelings. And many times with EFT tapping, the intention on the part of the therapist is probably to bring the patient back to the reality of the present moment. And I really like your slide on now is the present. Because what's happening is patients are stuck in the feedback loop of the past.
Right. So he's speaking just for a moment of the necessity and reaffirming what Suzanne said about with patients that get stuck in the past, and the importance of EFT as being one mechanism for bringing people into the present moment that helps to get them out of that negative cycle of past thought. Yes, one last question and then we need to close.
Yeah, just briefly, I think one of the big problems with the VA is that their wholehearted belief that PTSD cannot be healed. So if you have that belief, which they do, then they are not going to do anything to help heal it. What they would rather do is help them not have symptoms by giving them anywhere from 10 to 16 medications.
Sure.
Medical interact and counteract each other.
Okay, so as the final note, you want to...
Was that Huffington Post?
Anyway, yes, you want to have...
So this should encourage you. One of the people in the field who has been working for many, many years with veterans is a woman by the name of Belruth Nappersbeck. And I referenced her in that list, as well as Body Bears the Burden. And she just, there was just an article published, and I can't remember if it's Huffington Post. Yeah. Where she has this beautiful article stating, if you think PTSD can't be healed, think again. So I would encourage you, those of you who are computer literate, to go find there. Just Google her name and Huffington Post, and it's a beautiful article on, you know, it can be healed. And by that, yeah, anyway, read the article. It's a very beautiful article. And thank you very much for your patience. We know that was a lot of material and we only just barely scratched the surface, but we hope that it's helpful to you in your work.
Suzanne, could you say the name of the Huffington Post lady again?
Bella Ruth
Naparstek. It's on your resource page.
Oh, it is.
Okay.
Thank you.
So I just want to say thank you, and thank you for the day. If you have any further questions, we'll be around today. We have an email list if you're interested. We will be doing upcoming workshops that'll expand this into a day, 2 days, and a lot more depth, but in an hour and 15 minutes, we know we're just barely touching the issue that's so important. But really, we just want to say thank you.
We taking a break, Lyn? Or?
We're taking about a 10-minute break
Okay.
instead of 15 so that we can catch up for our time. All right. Well, thank you. Farm friend or